Rhinoplasty surgery represents one of the greatest challenges in plastic surgery. For this reason, it's absolutely critical that a careful analysis be performed on every patient who undergoes this procedure before the procedure is undertaken. To perform rhinoplasty surgery well, a surgeon needs to be an excellent anatomist, he needs to be a physiologist, he needs to be a psychologist and a philosopher, he needs to be an architect and an engineer. But more important than any of those, he needs to be an artist. For this reason, the analysis of the problem is critical and needs to be taken with an artist's eye. When looking at a patient, it's important to consider the nose in the context of the entire face. When a person is looked at by another person, their eye will immediately catch their lateral orbital rims, their cheekbones, their nasal tip, and their chin. If these structures have harmony, balance, and proportion, that person will be viewed as a physically attractive person. If the nose is too big relative to the other structures, it will detract from their overall physical appearance. It's therefore important that the size of the nose be evaluated in the context of the surrounding structures. It's also important that a series of internal numbers, ratios, arcs, angles be measured as well. We know, for instance, that in an aesthetically attractive nose, the distance across the bridge versus the base of the nose should be about 1 to 1.5. We also know that in an aesthetically attractive nose in a woman, the angle between the lip and the nose should be about 120 degrees. These are important issues and need to be analyzed very carefully in any patient who's contemplating rhinoplasty surgery. It's important to look at the gender of the patient, their ethnicity, and those issues need to be factored in as well. Finally, everybody has a slightly different idea of what constitutes an attractive nose. It's important that computer imaging be utilized so that the surgeon can evaluate the patient's idea of what constitutes an attractive nose, and so that the patient can understand what the surgeon can realistically accomplish. When this approach is undertaken, satisfaction rates tend to be higher than when computer imaging isn't utilized. For this reason, we recommend computer imaging on all of our patients who are undergoing rhinoplasty surgery. It's important to realize that this approach doesn't represent a guarantee, but it's a blueprint by which the surgeon can operate.